Hello, my name's Emmett Parker. I'm a physical therapist in Birmingham, Alabama, and one of my specialties is treating balance disorders, and which also can include concussions and vestibular problems. And so a lot of times we will see people that have both, where they can concuss their brain and they can concuss their vestibular system, although these are two different structures and often require different treatment plans. If somebody concusses their vestibular system, oftentimes they can have a lot of dizziness, vertigo, disequilibrium. They will also have a lot of difficulty balancing. So there's three main inputs to balance. There's the vestibular system, which is in your inner ear. Your eyes play a big role. And then you have little receptors throughout your body, we call mechanoreceptors, that tell you where you are in space. So all of these structures communicate with the central nervous system, which is the spinal cord and the brain. And they communicate at the balance center of the brain. And when they're all working correctly, we stay upright and balanced, and we go about our lives. And most of the time, we don't even know they're there unless there's a problem. So what we find with people that have experienced concussions is there's two things. They can have a central issue where the balance center of the brain is actually affected. That would be a central problem. And we can also have a peripheral problem where the vestibular system itself is actually concussed. And then sometimes you can have a combination of the two. And so when somebody comes in for an evaluation, it's really important to discern what area is impacted, whether it's peripheral, whether it's central, or whether it's a combination. And so we have a series of tests that we do that have a certain amount of sensitivity and specificity that can tell us how we're going to develop our treatment plan and what the best approach is going to be to getting people that have these types of injuries better. And so from there, we hope that we properly assess these patients and get them on the right treatment plan. And if not, we adjust it as we go, and then we advance them. But these are things that we used to have a lot of difficulty understanding and treating. Unfortunately, there's a lot of research over the last 10, 15 years that's come out. Some wonderful people that have put a lot of time and energy into the research and published some great information that we are now able to use that information to be able to come up with much better, more modern protocols. And so a lot of people that were suffering with these problems previously were not getting very good treatment. Our treatment protocols and plans were not very good, and unfortunately we were not very good at getting these people better. Now they're much more advanced, and the protocols and the treatment plans that we're putting these people into are working so much better, and we're able to resolve a lot of these injuries that previously people may not have been able to completely fix or get very good care for. So that's a wonderful thing, and we feel like we're able to help a great number of people, a much larger population of people, and it's really throughout the lifespan because these types of injuries can occur at any point in the lifespan. And so we're able to help them and get them better and get them back to a much higher quality of life and a higher level of function than we were able to, say, 15 years ago or so.